actually started as a volunteer mobile operation. And so we were really focused on health disparities in Oakland. And at that time, we're just looking at data, looking at maps, and figuring out where the disparities were greatest and the need was highest, and really honed in on East Oakland, which is where we ended up putting ourselves, sort of right in the middle of where some of the greatest health disparities are. And so we've grown from there. So we're headquartered in East Oakland, and we have multiple sites throughout Oakland and also in the South Bay. But we remain really focused on sort of that geographic area of East Oakland in particular, where the disparities still remain. And we mostly serve mostly African American population, about 85%, I would say, and then Latino and Pacific Islander folks, and mostly very, very low income. And we serve the whole life spectrum from newborns to elders. And we also operate a mobile clinic that goes out to the encampments throughout East Oakland, serving people with a medical team, basically going out where they are under the freeways and in homeless encampments. And we also run a couple of satellite clinics within youth shelters, so also serving very vulnerable young people from 12 to 24. In the early days, I think when the pandemic first hit, I think we felt, ready to respond because, as I mentioned, we've always been about responding to the health needs and the disparities that we're seeing. And unfortunately, with just about everything, we kind of expect to get hit a little harder in our community and to suffer some of the impacts disproportionately. So we were sort of on alert, like high alert from the beginning, and trying to really get our arms around where we would get the resources needed to respond and what was going to be needed to respond. So we really came out very early on to do community level testing and start providing community level education. Pretty far ahead of, we actually became the first walk-up site in the whole East Bay. So we were pretty far ahead. And part of that, I think, is because we are this trusted entity in the community, and we were anticipating that we would be impacted, and we were in the knowledge that there wasn't going to be anybody kind of coming to save us. We were going to have to figure this out on our own. And so that's basically what we did. We have a number of amazing partners, but I think really we've sort of pushed pushed ourselves and pushed everyone to respond as quickly as possible, because we felt like it was emergency for everyone, but it was going to be an even bigger emergency for our community. It was, the challenges were really, just very overwhelming at that time, I would say. So PPE was a challenge. We were really going everywhere, looking under every rock, and talking with everyone we could to get a hold of PPE. It wasn't just that it was, it was scarce, it was unavailable. When it was available, it was extremely cost prohibitive compared to, what it was before the pandemic. So there was just, everything was moving. So PPE was a huge concern. Testing supplies were a huge concern. It was everything from, swabs to reagent to, the lab capacity. And it was a real roller coaster ride with all of the above. And I actually remember early on matching up sets of PPE with tests, because you'd have to have the full PPE to do the tests, and you couldn't be reusing, things. And so it was really, all, these rate limiting sort of steps everywhere we looked. And so having to maintain really tight control over every precious little resource. And so, it felt like just a lot of scarcity in that time and a lot of unknown. And I think for us, we said, we cannot accept being unable to provide a service to our community because of masks or swabs or something that's in short supply. So we were very creative. We created a lot of new partnerships, a lot of new relationships that we're still benefiting from today, I would say. Therapeutics continues to be an issue. There weren't any, right? So the biggest problem was there really weren't any therapeutics. And even still now, it's a little disappointing that we only have really an infusion treatment that's outpatient type of a treatment. And so at that time, because we're outpatient, so really, for the majority of the pandemic, it was take care of it like a cold at home until you're sick enough to go to the hospital. And then the hospitals I know were also working with shortages and trying to make sure that they had remdesivir, et cetera. And so on the outpatient side of things, from a community health perspective, there really wasn't a whole lot to offer people other than counseling them on what would warrant an emergency room visit. And then more recently, after the approval of the monoclonal antibody combination treatments, access has been a challenge. And even more than access, I would say, is just making sure people were aware of it. And so that's still a place where we're doing a lot of work, is making sure that people, understand that there is a treatment. Once you're sick enough to go to the hospital, it's too late for that treatment. So it's something that you need to start early. So just a lot of education needed there, but definitely in our community, it was not like we had infusion centers or places available. It was pretty much go to the public hospital and, hope for the best, essentially. So that has improved. But certainly early on, that was a challenge as well. We didn't think we were going to see any, vaccines as an outpatient provider. We thought we would be waiting until much later, like the spring or something like that. But we were able to secure vaccines early on and have been able to secure all the vaccines. And so we were worried that we weren't going to have choice. And certainly in the beginning, it was kind of, take what you can get. But fairly quickly, we were able to get all 3 vaccines at our sites, which is really important in terms of, having choice for people. And so we feel very fortunate in terms of the vaccine. Of course, there was a number of challenges related to the vaccine as well, but in terms of vaccine access, I think that was the one thing in the whole pandemic where we were very pleasantly surprised about our ability to access it on behalf of our community. I think the work in a lot of ways is the same work, because a lot of the work has been being a trusted resource in the community, being a trusted source of information and education, serving people outside of our 4 walls, so to speak, being out in the community, being visible. And so a lot of that work is the same. And I think the core of the work, which is really around equity, it's really around centering the people that are most likely to be left out or the most likely to be harmed. And that's something we've done from day one. So I think those things don't change. I do think that there are new partners, new partnerships, new infrastructure that we've built, both on the on the technology side of things and in terms of even just interfacing with other entities. That was really accelerated more than any other time in our organization's history. So I think we are left with a lot of new tools and new relationships. And I think we're, really hopeful that part of what will be left as we kind of emerge here will be a redefinition of what the safety net really is, and that the safety net includes a lot of partners, some of them more likely than others, and that we all need to be pulling together, and that we need to be prepared. And I think that that was probably the big learning for me, I would say personally, and just as a physician trained in this country, is we were not prepared. And so, I definitely take some of those lessons in terms of what can we do to stay ready. And so those are some of the things I think that we're in some ways just now kind of getting to really reflect on and think about, how to stay ready, if you will.